Antimicrobial resistance continues to rise across Nigeria, driven by misuse of antibiotics in humans, animals, and the environment. Experts say the country's surveillance and containment efforts are still under-resourced as they call for greater resource allocation to strengthen the national response.
The truth is that if you have prolonged diseases or infections, it affects your productivity. Secondly, if you are infected with diseases that is incurable because it has already built resistance, sometimes it might lead to death. All right, so that means it's life-threatening.
Currently, it doesn't look like states and local governments understand that this is a problem, because when they understand there is a problem, they will allocate money at the state level, integrate it into their budgeting. They understand that there is a problem, they allocate money for awareness, for surveillance, monitoring and evaluation, to understand what is going on in our society, in the chemists, that people go to buy drugs. So when they integrate that, they start making allocations for it, they start raising awareness, they start making policies, they start getting companies, private sectors to collaborate and try and stop the problem.
Nigeria's National Action Plan on AMR outlines a clear strategy for surveillance, stewardship, and infection prevention. However, many laboratories lack reagents, modern equipment, and skilled personnel. Stakeholders say the consequences of underfunding could be severe, including treatment failures, prolonged illness, and rising healthcare costs.
A lot is needed in making sure that in the next budget next budget process that there are good allocations targeted towards this, because that is from where we're going to start from.
There are emphases on the One Health approach, integrating human, animal, and environmental health sectors as key to detecting resistant pathogens early and preventing outbreaks. Stakeholders are urging federal and state governments to prioritize funding for AMR in their budget planning for 2026 and beyond, stressing that tackling drug resistance is essential to Nigeria's health, security, and economic stability. In Abuja, for News Central, Aishat, Salihu.